This is Kai. She's a 5-year-old long-haired Chihuahua. She's not a regular patient of ours, but was referred to us by another veterinary hospital. Kai has pulled her left hip out of the socket, as you can see on this x-ray. There is a short ligament that holds the head of the femur into the acetabular socket, but it must be completely severed in order for the hip to come out of the socket like it has in this case. We've anesthetized Kai, and we're attempting to replace the hip back in the socket with closed reduction just by manipulating it. And here you can see that we have successfully replaced that hip back into the socket, just as we'd hoped. And here on the lateral view, it shows it as well. In order to keep the hip from just falling right out again, we use a special kind of sling called an Emer sling that keeps that head of the femur rotated into the socket. There's always a big concern that when we take the sling off, that the hip may just reluxate. We're hoping that the joint capsule and the gluteal muscles will contract and scar in to hold that hip in place. And here we can see that she's using her leg just fine. We've clipped the hair away in order to put that sling on so we can tell which leg it is. And we're expecting a complete recovery as if this had never happened.